Okay.
We'll be live in a few minutes on the radio on Heart of Innovation.
Thanks everyone for joining us on YouTube and on Facebook and across all social media. You're here in the behind the scenes of our radio show, broadcasting on KDOW in the San Francisco Bay Area. So stay tuned.
AM 1220 KDOW.
Sponsored by The Way to My Heart Incorporated.
Welcome to the Heart of Innovation, 60 minutes that could save life and limb with new breakthrough ideas and innovation changing the healthcare landscape. Brought to you by Patient Advocacy Group, the Global PAD Association at padhealth.org, in partnership with Reflow Medical, the pulse of medical ingenuity. Here are your hosts for the Heart of Innovation, Emmy Award-winning journalist and founder of the Global PAD Association, Kim McNicholas, and interventional cardiologist and founder of Save My Piggies Health and Wellness, Dr. John Phillips.
Hi, everyone, and welcome to a really special show. Before we get into it, I have a little special surprise for Dr. John Phillips. Happy birthday to you. Happy birthday to you. Happy birthday, dear Dr. John. Happy birthday to you.
Wow. Thanks, Kim.
And many more years of saving piggies.
Yeah, definitely. Thanks. Yeah, had a little birthday yesterday. Appreciate the well wishes. Another trip around the sun, right? And so, yeah, happy to join the. I'm 50, right? So that's crazy.
Join the club.
Yeah, join the club. But Kim, you get so this plays into the quote for the day, but you start to reflect on your life and you look at where you were and where you're going. It's kind of sobering a little bit of a way, but it beats the alternative, that's for sure.
It completely does. I mean, I feel like I'm still 30. I mean, I probably don't look 30 anymore, but I feel like, 50 is the new 30. That's what I'm just going to say. Now that I'm 50, I just don't feel what I remember looking at my parents at 50 looked like.
That is kind of strange too, because you're like when you're younger, you think, man, 50 is old. And so I'm like, oh boy. But someone was telling me, and I don't know, and Kim, you don't have to answer this, but they're like, you're going to be getting stuff from AARP here pretty soon.
I did. I just got my first letter last week, and I was completely insulted. I was so insulted. I literally got the first email. The first mail piece in my mailbox last week.
I mean, I guess that's cool because I don't know that I could retire right now. I maybe could, but I wouldn't. But I guess people are retiring at 50. That's sweet. So kudos. But I don't know. What should I be expecting? Do I get like a little welcome letter? Is there a magazine? What happens?
I didn't open it.
Oh, you didn't open
it? I was like, I don't need AARP. I mean, I feel young. I'm, trying everything I can to stay healthy and exercise and
so
eat
did you
right,
make any did you say, okay, now that I'm 50, I'm going to do this that I wasn't doing before, or
nope.
No?
I'm just continuing because I now look at it as 50 is just a number. Yeah. I don't feel 50. I feel a lot younger. And thankfully I got my mom's genes and I don't have a bunch of wrinkles.
Yeah, I do, but that's okay. Maybe a little, so because you got to be careful, right? Because once you start doing things like Botox or whatever, which I wouldn't do, I mean, like you're opening up Pandora's box there, because once you start, it's hard to stop. I know a lot of people that color their hair. I'm not one of them, but that too, like you have to stop at some point, right?
Yeah.
So
I think I was just talking to a new nutritionist that is an advisor for the Global PAD Association, Sarah Brando. She just is starting some research in the UK. She's getting her PhD on the gut biome. And that is one thing. So if you say there's one thing that I am doubling down on now since my birthday, the whole month and a half ago, is I'm doubling down on the gut biome, because it turns out, causal relationships between, for example, heart disease and even PAD. I just read a 2024 study this morning on the causal relationship between the gut biome and the development of atherosclerosis, specifically in the legs for patients with PAD. And it names the specific bacteria in this study that they think actually leads from the gut into developing atherosclerosis. So I find that really interesting.
Yeah, I've doubled down on some vitamins and peptides. I actually started taking BPC 157 for a little bit to help with. And honestly, it's kind of strange. Maybe it's placebo, but frankly, I don't care because it helps with workout recovery and things of that nature. And I've been on my NAD plus now, injectable, for about 3 months, and that's definitely helping with recovery and energy levels. So you're right. You got to just kind of double down on certain things and whatever. It's just a number. Tony Horton, the guy in P90X, Tony Horton, like I remember doing some of his videos. He was 55. He looked like he was 35. So we can all do it. It's all good.
Exactly. I agree with you. I even have to say one more thing about it. I'm doing pomegranate pills now, pomegranate supplements.
Oh,
so
okay.
I'm seeing how those work.
What's that supposed to do?
It's just supposed to be really good for your cardiovascular health. So I'm seeing it's supposed to give you more energy and boost your mood and your mindset, your clarity. So we'll see if it does anything, and then I'll report back.
I will. Yeah. So yesterday I had office hours, and one of my patients. I'm not a big birthday guy, and at any rate, my nurse practitioner and nurse and everybody were super cool about it, and they made some. My wife Carolyn got him some banners and stuff, and so one of my patients found out I was 50, and she wanted to give me a birthday spanking 50 times, and I was like, man, I don't think we can do 50, but she got a couple licks in. So
that's hilarious. I see Dr. Salhanick is here. He's laughing so hard. I don't know. Have you ever gotten a birthday spanking from a patient?
Yeah.
Dr. Marc?
I have not. I have not had that request. Interesting request. Dyeing your hair as we grow up and hairs turn gray. For those of you on the radio who can't see, I don't have that issue because I have nothing up on top there right now. And so instead of me dyeing my hair, a patient, actually a staff member, recommended that we just give me a wig that has been dyed.
Oh, there you go. That's cool.
So there are a few pictures of me last year with some colorful wigs, and that has become a tradition, apparently.
There you go.
And I assume it's not your patient Benny that's here with us. He's going to be sharing his story in just a few minutes, which we'll get to. But Benny, you'd never give a doctor the birthday spankings and a wig.
No, nothing like that.
That may be a uniquely San Francisco issue about getting birthday spankings from a patient in a wig.
Yeah.
Oh, so no, it's Columbus, Ohio.
I'm Columbus, Ohio. But
okay. There we go.
This particular patient has a very colorful past of interacting with athletes and things. So it's right up her alley. She's super sweet.
That's awesome. So I want to get to Benny's story at the start of the next break. So what do you think? Right now, before we go to break, let's get your moment of inspiration.
Dr. John Phillips' spectacular vascular moment of inspiration.
So 1 minute left before break. I think this quote from Mark Twain kind of ties in a lot of things, but it ties in birthdays. So Mark Twain is quoted as saying, "The two most important days in your life are the day you are born and the day you find out why." I love that quote.
I love that because, I mean, especially at 50, have you really realized your true purpose in life? I know it's to save piggies, but do you have something else that you have pondered?
I'm actually starting to bake. I'm trying to make some protein bars. But no, you're right.
Purpose is to make protein
I think
bars.
you have to accept what the good Lord has, I believe, put me on this earth for a reason, and among other things, it is to try to save some piggies. So here we are, and we're doing the show, and I love it.
I'm curious from Dr. Salhanick, do you have, in just a sentence or two, did you discover your true purpose?
I did. I think it's two things. One of them is to have a wonderful family and raise children, which we're embarking on that. And then I think the second thing is to take care of patients the way that you want your family members to be taken care of, and to try and provide that in the world. And I get a great opportunity to do that, and called to take care of these vascular patients to save these piggies, as Dr. Phillips has said. I love that. When I had heard about you and I saw that phrase, I was like, that is genius.
It
I've started
is
telling
genius.
patients that all the time, and they are loving it. It just encapsulates all the important things, and also just kind of how basic it sounds is how basic it is. I mean, that we
Yep.
should be really striving to try and do what we can to save the limbs for these patients.
Love
And
it.
coming up
Love it.
next, right here on the Heart of Innovation, we're going to find out how Dr. Marc Salhanick is saving those piggies, particularly Benny's piggies. We're going to get to Benny's why as well. He wants to keep his legs intact and live a better quality of life. We'll get to all that in just a moment and more right here on KDOW. Okie dokie.
And
We have a
clear.
lot of fun. Sorry, I forgot to warn you that we kind
That
of
was great.
bullshit a little
I
bit
love
in
that.
the first.
Can you say shit on the air? Oh, we're not on the air.
We're not on the air.
We can say it on YouTube.
That's true. That's true. We can say it on YouTube.
We can say it on
shouldn't.
YouTube, but I don't want to send, Christy,
Right.
scrambling.
That poor
at
guy's
that
gonna
point.
have to hit the.
Hit the blink
Christy,
button. We're
they
got
7
the-
seconds.
they got the dump button.
I was gonna say, do you have a? They must have a button that
They do.
can like
Yeah.
pause us or whatever, in case one of us goes off the rails and sideways.
Oh yeah. It's all
So,
in the delay.
True.
we are going to start out into, whatever. John, you want to take us back?
Yeah. Can I
when we wanna
enter
get-
like how you guys hooked up, Kimberly? Is that how'd you find Benny and Dr. Marc?
Yeah,
Okay.
because I, talked to, and I want to go back to, before we get into, we want to get into the whole kind of, so Marc, once I kind of lead to you, then, if you can guide Benny through his story, like all the way back. Hey, Benny, were you misdiagnosed a bunch of times? You're so young. How old are you?
47.
Jesus. Yeah.
Yeah.
And did you have a
30
history of
seconds.
diabetes?
No, not until I went into the hospital after this. So first time I had got sick and they diagnosed me with endocarditis. They said I had an infection and said that it was affecting my heart valve, and that's when I was first diagnosed with diabetes. That was back
Interesting.
at the end of May.
That's 800
Oops, here we go.
Here we go.
23.
AM 1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. Thank you for joining us on a lovely Saturday here in Columbus. I imagine it's beautiful in San Francisco. Miss Kimberly, let's jump right into the show, right? We spent some, it's kind of like, I forget how quickly time goes, and you and I are just BSing for the first segment, and then like, oh yeah, we've got to talk to some patients and a fantastic vascular surgeon. So how'd you guys, like, how'd you put the show together today?
Well, we were actually introduced by the sponsor of our show, Reflow Medical. Gunter Haynes introduced me to Dr. Marc Salhanick. He said, hey, have you met this vascular surgeon? He's doing some advanced work over there in Dallas, Texas. And he actually was under another vascular surgeon that is a limb salvage specialist we work with often, which is Dr. Michael Sia. And so we got introduced, had him on recently, and he was a hit with patients, very detailed in the answers he was giving patients to their questions. And we started talking about the retractable stent that Reflow makes. And he says, actually, I just had a patient with that and he's doing great. And he has an amazing story. And I said, well, that would be perfect for our Save My Piggies, episode. And so that's what we're doing now. Again, Reflow Medical has nothing to do with the actual content of our show.
Right.
And we are going to give, Benny a little gift certificate for his courage and for participating for Amazon. So we really do appreciate him being here, but I want to disclose that. But Dr. Salhanick, can you introduce us, a little bit more to Benny and his story? And, we'll start unraveling, kind of pulling, the pieces of the onion away.
Yeah. So thank you for that wonderful introduction, Kim. So Benny and I first met about a month ago, maybe a little bit more than a month ago, in like August. And he had a prolonged hospital stay at one of the hospitals that we work at because in May of this year he had endocarditis, which is an infection in the heart valves. And Benny, what was going on? You had told me when we were first in meeting that you were having a lot of pain in your legs after you had started to recover from your heart valve replacement. And how was it talking to the other doctors? Can you kind of remind me about that?
Nobody could really give me an answer. I never had any problems walking or any pain in my leg before the heart surgery. And
Yeah.
then once I got home and started to get better, like it was painful to walk like all the time, like even little short distances. Had a lot of pain like right behind my knee area and down in my calf, and I hadn't had that before.
Yeah. And finally, his cardiac surgeon actually had been listening to him and referred him to our practice. We evaluated him, and if you remember right off the bat, we got your shoes and socks off, and I felt for your pulse, and I said, you're a young man, and you
Yeah.
should have a very strong pulse, and you not only have, it's not even like a weak pulse, you have no pulse. And what I mean by that, and this can be confusing sometimes to patients, is that if you have uninhibited blood flow from your heart down to your toes that's sufficient to heal, you should be able to palpate or feel a pulse in your foot. Not just listen for a Doppler signal, but actually feel a pulse. And he did not have that. And so we said right off the bat, we know there's a problem with your arteries.
Was there any correlation to so the endocarditis? Again, that's an infection within the heart valve. I'm not sure which valve it was, but was this from embolization, meaning debris blocking his arteries, or were these two totally different phenomenon that he had?
I think it's pretty hard to tell. The reason being that, again, you are a young man to be having this. You didn't really have any risk factors for it either. So you kind of had this heart infection. Likely there was some embolic event, meaning that a blood clot has gone from a part of the heart to another part of the body. And my suspicion is that it maybe got stuck in one part. But the thing about it is that it had completely taken out. He had no blood flow in his popliteal artery, which is the main artery behind the knee, as you know, Dr. Phillips. So the thing about it is that if he had had normal blood vessels to begin with, anybody that has a sudden blockage of that artery would immediately have a problem that would have been limb threatening. We would call that acute limb ischemia, as you know. So that means that his limb would be at risk of dying within hours. And that wasn't what was happening. So there probably was, we would call it ischemic preconditioning, as you know. And what we would mean by that is that he's used to having some low blood flow, but his body was kind of doing okay with it. And then there was something that tipped him over the edge. In addition to that, Benny, if you remind me, you also had some pressure ulcers, particularly on that right foot, from what I remember.
Yeah, from my hospital stay when I had the heart surgery, I was in the hospital for 26 days. And right before they discharged me, we had discovered I had pressure wounds on both of my heels. And since they had got infected, so I ended up back in the hospital to get those taken care of.
So Benny, so you had open heart surgery to fix your valve? Is that correct?
Yes.
Okay. Which valve
They
was
put
it?
on a mechanical valve.
The aortic valve?
I'm not sure which one it was.
Okay.
But they did place a mechanical valve.
Yeah, it was aortic.
Gotcha. Okay. So you're on blood thinners now?
Yes.
All right.
So it's always interesting when I talk to patients about their PAD. There are a lot of doctors that don't get to the heart of literally the heart of what is causing the clotting or the blockages in their legs. I mean, you'd be surprised how many doctors do not. And one of the things that we have found is when we tell a patient, hey, you've tried hereditary clotting issues, you don't have diabetes or whatever, have you asked for a heart doctor to check your valves for AFib or valvular issues? So your valves can actually throw clots, right, Dr. Phillips?
Yeah, I
It
mean,
can cause
if
clotting.
they can, that's pretty rare in this case. So, like, again, you wonder, to Mark's point, like it sounds like this was subacute, and if he had completely normal arteries and then he embolized a piece of debris, so it just kind of went from the heart and kind of gets stuck someplace and it often does get embolization, AFib embolization often gets stuck behind the knee, but clearly he had probably some underlying disease, and we're going to get into how it was treated, but definitely, I mean, when you look at it, the overlap, it's about 40. Not quite 40% of people have PAD and coronary artery disease. I imagine Benny had a heart catheterization prior to having his valve replaced, because that's pretty much standard of care. So presumably, Benny, your heart arteries are clean, right?
Yes.
That's good. That's good.
And coming up next, we'll find out what was done to treat Benny and get him back literally on his feet again. That's next right here on KDOW and the Heart of Innovation. Don't go away.
Pro. Kim's a pro. Kim is a pro. The segues.
Oh yeah.
Stay with us. Don't go away. We'll be right back. Me, I'm always like, welcome back, everyone.
That's why she's Emmy.
Exactly, man. Like that's why I will never have an Emmy.
Emmy level.
So
for the next segment, we can go into the treatment.
Yeah, let's do it.
I do want to emphasize, I think it's important that we maybe start that next segment. I had forgotten, Benny, that you had been readmitted. So you had 2 hospital stays where pretty much you were like told, yeah, you're okay.
Yeah. This is the
they said
second time.
But for the leg or the heart?
Sorry, what?
Was it you were readmitted because of leg issues, Benny, or heart or problems with the surgery?
The pressure wound that was on my right heel got infected. When they first discharged me from the hospital, they said, "Oh, don't worry, they'll be okay. They're starting to dry up." But after about 2 or 3 weeks after I had got out of the hospital, the one on my right foot split open, and it ended up getting infected, and that's why they readmitted me to the hospital.
Oh, I see. So were you? Did they do? I imagine maybe they didn't think you would have a vascular issue because you were so young, but indeed you did, and that's partially what caused the wound, the pressure ulcer, and then to obviously not heal. Is that right, Mark?
Yeah, I need to remind myself because me and another guy read the ultrasounds at the hospital, so I can't remember if I read his ultrasound. But the thing is that if you rely on the ultrasound only, you will not catch this because he actually has really good collateralization, and you can see that on the angiogram. And if the ultrasonographer is not being careful, they're going to catch one of those collaterals, and it's going to look multiphasic. So then the reports are, oh, it's multiphasic all the way down, and they've missed the popliteal occlusion. And he had a CTO right in like P2, and then all of his tibial origins were also occluded. And this is on both sides.
This is where some doctors will actually, and some surgeons will say, well, he has the collaterals, so he's fine. We're not going to do anything.
Exactly.
Which,
so even if they did, I mean, as you saw, they should.
Right. I mean, at least it's okay. If he doesn't have wounds and he's not having rest pain and it's claudication, leave it. But you had to do something because he.
But the issue is that, and that's why I pointed out he had pressure ulcers. And, heel ulcers, I mean, that's just the most, to me, that's actually the most dangerous form because you get calcaneal osteo, you're hosed.
Yeah, exactly. Okay. So this is a short segment, 3.5. What? Oh, sorry.
We probably should get into because all that stuff was so interesting. Would love to get that into the.
Yeah, we'll dive into that.
So, Benny, I hope you don't mind repeating yourself a little bit.
Okay.
Did you say there was 30 seconds?
How long is this next segment?
6.5. 6.5.
But I'm also curious how long before he had the leg pain. Before all of that.
1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Thanks, everybody, for hanging out with us on this Saturday. Another Save My Piggies, allowing patients and their physicians to tell their story. We're here to advocate for patients, and we want to keep limbs on their bodies. So Benny, I mean, we were talking during the break. After you were hospitalized, you developed a pressure ulcer. It got infected. Now we've got to figure out, okay, how we're going to treat this. What's going on? Marc, you obviously got involved in his care, and certainly helped out with making the diagnosis, because sometimes we miss these diagnoses, and if you get an infection, that's too bad. People can lose their leg, and that would be really, really unfortunate in this situation for Benny.
Yeah. And John, I want to point out a couple of things. So I got in the game late. Benny had his heart surgery in May, not having any leg pains, left the hospital having pains when he walks, which we call claudication. It's a wonderful Latin term. So we've known about it for 2,000 years, that if you don't have the blood flow, it's going to hurt. So he also left the hospital the first time with pressure ulcers. And was told, well, it looks like it's healing. You should be fine, which a lot of people hear. And then he comes back again with a specific complaint related to his wound on his right leg, that it had become infected. And that was the issue that I was bringing up with you guys during the break, that it's very easy to evaluate these using things like ultrasound, which I use a lot of. I think is a great tool, but I think you have to really understand the limitations of it. And one of those is that it can miss things and it can fool you. And if you have a technologist, an ultrasound sonographer that is performing this procedure and looking in the wrong spot, a doctor that is reading that ultrasound may miss the fact that there's a blockage there. And I have some ultrasound images that you'll be able to see, and we can point out the subtleties in it, that it's very easy to miss these things if you're not really paying attention. But the biggest thing for me, as we had talked about before the break, was that he did not have a pulse in his foot. And that's really got to be the key here, especially in an otherwise young and healthy man. And so,
right. And in your experience, too, I mean, like he shouldn't have left the hospital with pressure ulcers. I mean, like that,
not with the combination of the pressure ulcers and the new pains with walking.
Exactly.
And those are two things right there that really, the clinical acumen needs to be there to say, you know what, something's new, something's changed. We should investigate this more.
But this could have gone sideways pretty quickly for him.
Very quickly, because as we were also talking about, it's not just that he's got a pressure ulcer, it's that he's got a pressure ulcer on his heel. This is an area of the body that has very little tissue coverage over the bone. It makes the bone very susceptible to infection. And once that bone, the calcaneus bone, gets infected, it's a really difficult infection to clear. And unfortunately, I've had a number of patients that have ended up proceeding with amputations because we just couldn't provide them a meaningful solution that they would be able to walk with their leg.
I'm curious, from your experience, you had this pressure wound on your foot, and you brought this to the attention of the doctors, the nurses, the entire staff at the hospital. What was the conversation that you were having with them and their response to you the first time, and then the second time when you ended up coming back with an infection?
When I first brought it to their attention, it was like that Friday or Saturday before I was discharged from the hospital on that Monday. And the wound care doctor that I brought it to his attention, he, like I said, he didn't think it was that big of a deal. He thought it was going to be fine. So I had never had anything like that. So I just kind of took their word for it. And okay, he says I'm going to be okay. So I'll go ahead and go home. And like I said, having to go back and forth, I had a lot of doctor's appointments following my discharge. And, can't really go to the hospital and doctor's appointments barefoot. So taking shoes off and on and everything, I had it bandaged up, trying to keep it protected the best I could, but they eventually split open.
So, oh, wow.
And that's just because, when you don't have the blood flow, it ain't going to heal.
Right. So Benny, were you managing this wound by yourself?
Yes. I had went back to the cardiologist that performed the surgery, and I was letting them know about it, the pain in my leg, and they kept saying, "No, we'll set you up with wound care," and it never happened. And then that's when they referred me to Dr. Salhanick.
Well, the cardiologist actually ultimately ended up referring you to Dr. Salhanick.
Yes,
it was the cardiac surgeon. Yeah.
Oh, that's fantastic. So at least he listened. You didn't get the wound care, but you did get the referral you needed over to the vascular surgeon.
Yes.
And
Yeah,
it's
these
so funny.
balloons.
For those of you that are on
Man, I don't know what I'm.
YouTube, you keep seeing the birthday balloons coming up, and we're not sure where they're coming from on Zoom. Maybe someone could enlighten us. We're not celebrating. I guess we're celebrating that Benny also got to Dr. Salhanick, and Dr. Salhanick, you were able to save his legs. And coming up next, right here on the Heart of Innovation, we're going to hear about that treatment that ultimately we are celebrating that saved Benny's leg. And he's now in rehab. And we're going to hear all about his recovery and his purpose for keeping his legs intact. What does he want to do to live a better quality of life? We'll find out next, right here on KDOW, the Heart of Innovation. Don't go away. Man, Dr. John, you just keep making it harder and harder for me to do these transitions.
I think this has something.
You have to throw balloons now into my.
No, you did great though. I think this has something to do with my app, my MacBook, and the camera. Whatever, Joshua, you probably know. Someone must know what this is. Something.
Honey, did you see the balloons?
Can you imagine doing this like a serious Zoom call with your boss or something, and you got balloons coming up and whatnot?
Yes.
It's funny because
So, Mark, do you want to because I suppose we should jump in. We've got 2 segments left, and the 5th one is short. So
yeah, I'm
go into
ready to rock.
Okay.
I can share my screen.
Oh, there we go.
With the that's wonderful. I've got the actual angiograms up. Where it's pretty demonstrable. You can see the PT occlusion or the pop occlusion. And then what we'll do is we'll wire the PT, and then we'll treat that with atherectomy and angioplasty, and then we'll proceed with spur. And then we have a 1-week angiogram because we came and did the other side a week later. And in that other side, we said, let's take a look at the right side again. So 1 week post, you can actually see that it's even better. And then we have the ultrasound to show that as well.
Cool. Okay. Yeah, that'll take us. That'll take some time. Love it. 4-minute segment for 7 minutes, 7.5. So.
Okay.
That's great. And you don't have to. You can just. Do you want to go ahead and bring get ready? Just start to hit the share, and so it's going to be kind of ready to pull right up.
Excuse me.
Oh, now, Dr.
Oh, man, what is going on here, you guys? All right, hold on a second. Let me try to figure this out. It's called Center Stage. Well, okay. Yeah, there's all these kind of like cool studio lights, reactions, background. The old MacBook.
It's like when we went to a taping of the Maury Show.
Maury Show, you did? Really?
Oh, yes. Oh, there's a whole great story behind there. We have a signed painting now by Maury. Maury did not paint it, but he signed the painting. It's a great story.
Maury.
That is awesome.
What was his last name? Okay.
Bovich,
yeah.
So funny. Okay. Yeah, I'm curious. You weren't experienced, so this is more of an event that there might have been some ischemia in there, right? I mean, there might have been just some plaque buildup in there, but the clotting, possibly from those events with the heart being in the hospital, whatever it might be, might have done it, is kind of what we're looking at.
Yeah. I think that he had some plaque or some high-grade stenoses in the distal pop, and he had collateralized, so he wasn't having a claudication. And then he got some kind of embolus stuck down there, and that embolus then took out the rest of his distal popliteal and the origins of the tibial arteries as well. And so then that took out more of his collaterals, and that is what led to the claudication, which was a kind of a giveaway symptom for the fact that he did not have sufficient flow to heal.
Mm-hmm. Plus the heel. I mean, yeah, there's a lot going on there.
And I'm assuming that so it'd be great to get to, Benny, on if you knew anything about, the type of technology that you were using and his thoughts and what you're, Benny, also what you're doing now. You're in rehab, right? How bad did that wound get?
It was pretty bad. It had the infection had made me get sick, and when I went to go see my infectious disease doctor, that's when she was like, "Yeah, we're gonna put you back in the hospital."
Yeah. I'm like, that's the last thing you need too, because you have a new valve now. So, I mean, you
30
not want
seconds.
that valve to get infected.
90 seconds.
No, 90
30
seconds. Oh, 30 seconds.
Oh, 30
We got a
seconds.
picture of the wound too.
Okay.
Oh, okay.
It's looking much better. Benny's doing great.
Oh.
Do you feel good, Benny?
Good.
Yeah.
Much better. And the whole goal is
rule out foul play.
Keeping him on his feet.
SRN News.
AM 1220 KDOW.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. We are here. We're better than ever. We're having a great Save My Piggies. So, Mark, let's just jump into it. Obviously, so we know that Benny has some significant blockages going on based on your exam. So you figured, okay, we're gonna do an angiogram, take some pictures, and for those of you that are watching us live on YouTube, you can see these images here. So why don't you walk us through this stuff?
So we're playing through these images right now, and what you're seeing, everything that's black is blood, and the blood's moving down as it normally does. I spared you the earlier ones, which show a very normal angiogram. It looks pristine. It looks exactly the way it's supposed to be for a 47-year-old man with no artery issues. And then you get to this area right here behind the knee, and then you see that it suddenly turns into just this wispy collection of spidery looking things, and those are your collaterals, the bypasses that your body normally makes. And you just see a nothingness in the middle of the screen right here that I'm circling that should have blood flow. And if we go to the other side, this is what it looks like further down on the leg. You see that the arteries that are in the middle of the leg actually do come back as they should. And it looks like he's got a pretty significant amount of blood flow below the leg, which is great. So this means that this is a highly treatable area that we could very easily get to with endovascular techniques. And even the area of the wound I'm circling here on the heel has really good blush. So
walk us through your treatment process, because did you think as a vascular surgeon, I mean, you could, in theory, have done a bypass or
absolutely
attempted?
So this is a scenario where we could very easily do a fem to distal tibial artery bypass.
Right, from the thigh to the lower leg.
Exactly. And there's some data now with single segment saphenous vein with best CLI that says that's probably the best way to go for long-term healing results. But I think that also is
maybe.
Yeah, I think there's a lot of caveats to that. And I think when you really dig down into the data, I think at the heart of this, really, it needs to be do what you can, get the best results on for the things that you need to get the best results on.
Amen.
And what we're trying to do here with Benny is we're trying to get this wound healed because, as he told you before, he didn't have any problems with walking before all this. And if we can get him back to where he was, we don't need him to have a bypass to live a long, normal, happy life. As you can see from this, all these squiggles, his body can make that bypass for him, which is going to be ultimately a more durable thing that's not going to require him to be laid up in the hospital, have all these other wounds that he's got to heal. And at the very least, it's worth trying to do this as a first attempt. And if it's unsuccessful, we can always do the bypass.
Love it. Yeah.
So, I mean, the whole key is to always make sure that you the doctor you're going to, and I tell patients when you are going in for a procedure, you always ask what's the contingency plan to make them think about preserving potentially if you do go in endovascular with wires and balloons and stents and things like that, whatever it may be, in a minimally invasive way, that they preserve an area in case a bypass is needed and they need a nice pristine area to reattach that vein graft.
And that's why I really love the idea of no leave behind surgery, because we always have the option to come back. We're not going to have to fight the stents. We'll have to fight some of the inflammation, but that's a lot easier to deal with than having to fight stents, which I've had to take a number of other patients back from other doctors in the city that have put in a bunch of stents, and it just makes life a lot more difficult. which is why it's so great that Reflow has this option now, and I was very excited to use it. So what you
So,
see
yeah,
on the
walk us
screen here,
through
yeah, you
what you
see that
used.
we have a wire that's trying to cross. We eventually are able to cross. And then this is us inflating this balloon. And what I want to point out is you see all these areas of narrowing on this balloon, indicating that these are areas that are not just filled with some clot from, some embolism that Dr. John and I had been talking about. These are areas that are artery that is damaged. So this is an indication that the artery has been damaged in these parts, and you just can't see the blood flow in other ways. And so we were able to treat those. This is us delivering the spur device here. You can see
Yeah,
is a
talk about what exactly it is.
so it's a retractable stent. So on the next image, you see that we're actually able to deploy a stent here, and it has these spikes in it, which are a really interesting technology. You would think that they would be damaging to the artery, but what they do is they really add a lot of support to the artery so that we can inflate the balloon on the stent, and then we can just retrieve and suction it back into, it's not even suction, we can just collapse the stent back onto the delivery mechanism, so we don't leave anything behind. The key with Spur, I think, is that it provides a scaffold to the artery that allows us to push everything out of the way. And then as the balloon comes down, we can have what we would call patent flow, blood flowing through the stent while the stent is up, keeping the things that we just ballooned and tore and pushed out of the way, keeping all of that pushed to the side. Then we collapse the stent, and the blood flow itself provides the pressure to keep all the other contents of the artery stuck onto the wall. One problem that we can have, and Dr. John, I think, has mentioned this in other segments, is this idea of tearing the artery or causing a dissection. This can lead to a blockage in flow or flow limitation and require stenting. I think this technology here is revolutionary because it provides a way for us to allow the physiology to return and pressurize that artery in a way that prevents these dissections, at the very least prevents them from being flow limiting.
Yeah, and I think that it's again, to me, it's definitive treatment, meaning this is kind of the last thing that we do. So we're still, because the device just got FDA approval not too long ago. So I think we're still trying to figure out how to use it and where to use it. I've actually changed my algorithm already. I leave the balloon up with the spikes, the stent and the balloon longer, and I have less time now with just the scaffold, so to speak, without the balloon. But nonetheless, I mean, it certainly, I hope, is going to be as promising as I think it will be. Yeah. Did you do any atherectomy at all, or was it just straight up?
Yes, I didn't show the atherectomy, but we used a laser because I had a suspicion that there was going to be some thrombus, maybe old thrombus, and that it was kind of that cardioembolic issue. So I thought laser would perform very well in this area that would allow us to deliver this device. And
how long did it take to do the procedure?
30 minutes.
Yeah.
We actually did his procedure first thing in the morning, and then I went to clinic in another part of the city right afterwards. So
and home the same day, right?
Was
he hospitalized?
He was hospitalized at that time for some other issues related to the wounds, and so this was again just we're thankful that we could kind of cut down on the amount of time that it took to get this done.
And I know we only have like 30 seconds left, but I think also the fact that he had an infection, maybe doing bypass probably wasn't the right first option, because you don't want to have that get infected or things of that nature.
Yeah, I mean, I think we could get into a very long argument about bypass versus endo. I think at the end of the day, you have to take a look at what is the wound tissue burden, what is the level of disease that you're dealing with, and what are the options that you have if one is going to work or the other. And it just seemed like that was a long run for a short slide. We could get him this revascularization, we get the wound healed, and then he's done, and he doesn't have to deal with any of the consequences of having open surgery.
Awesome. Were the piggies saved?
We're gonna find out.
The teaser.
Oh, that was supposed to be the teaser. Well, coming up next, right here on the Heart of Innovation, we're gonna hear how Benny's doing since the procedure in rehab and what's next for him. So don't go away.
Sorry. Okay.
The teaser.
Yes.
Quick teaser.
So here I have and I'll just actually move these slides.
I mean, the nice thing too, I mean, his
next to each
pedal
other.
arch was completely intact, so you had a lot of options there. And
Yeah.
did it wire pretty easily?
No.
Oh, okay.
No, actually, it required escalation, and so the arch actually isn't really intact. And so, Mr. Myers, or Benny, you do have disease, right? Let me share my screen again. You do have disease in your foot, right in this area that I'm going to show you right in here. And I don't want to spend time on the call talking about it, but this is a normal artery coming in right to about here. And then here, this is just diseased artery. And then you can kind of, I wish I could move this box out of the way, but you can't really see, maybe it'll do it here. Play that. No, it's not gonna do it. Okay. But you can't really see on the bottom.
The plantar is a little.
Yeah.
Okay.
So what I wanted to point out is that you can see the pedal acceleration time here. And we actually measure an acceleration, not just a time to peak distance or difference, because I think you'd miss that. You can see the acceleration time is 120s, which we know based on our own practices data, if it's under 500, it's not sufficient. And so the other thing I want to point out is this is pre-op. You can see it's not a bad waveform. It looks actually pretty normal if that's all you're going to focus on. But then when you come in and that's the wound there. But when you come back, you do the angiogram and you fix that. Now you see his acceleration has dramatically increased. And there's return to that triphasic appearance where there's that actual reversal of flow in addition. So I think that this is a good example also of how ultrasound can fool you if you're not paying attention to the subtleties.
But the wound looks pretty. Is that after the procedure?
Yes, this is from last week.
Because she's bleeding pretty nice. That's
There's blood.
That warms the insides because that is well perfused.
Absolutely.
He's gonna do well.
So we should probably start. We have 2 minutes and 48 seconds in the last section. I'd like to get to
Benny,
just close out. The DS flow. Show if you can show the heel, because people who are in the show itself aren't seeing the heel. So, Dr. John, if you want to open up and have him just open up on this and say, "Hey, welcome back. You probably not what you expected. Warning, a little late." But there's a heel wound that it looks like it's getting better. Let's hear from Benny. And then, in the last couple of minutes here, what he's doing, what he's experiencing, if the pain's going away, whatever you want to ask him in your Save My Piggy experience. I also want to give a shout out to Robert Threet, who is watching via YouTube right now. He's kind of going through some similar situations. Young guy. He says that he's learned so much from watching all of our segments, hoping he gets to another doctor to get his outflow taken care of. But he had his pinky toe removed. He's had a couple distal bypasses that they keep failing, but they're not going in and they're not using wires and balloons. They're like, well, there's no outflow, so we can't do anything. I'm like, no, you can use wires and balloons. Like, why aren't you doing something with wires and balloons? But
I did that on Thursday, and it worked so well that now he has infection in his toe.
1220.
And maybe we could talk for a few minutes after with Robert.
Welcome back to the Heart of Innovation. For more on today's topic, go to theheartofinnovation.org. That's theheartofinnovation.org. Once again, here's Emmy Award-winning journalist Kim McNicholas and interventional cardiologist Dr. John Phillips.
Welcome back, everybody. As they say in the baseball world, we are rounding third here on the show. Those of you that are watching, we were able to see, and you can see Benny's wound on the heel. It looks like it's well perfused. It's bleeding. Benny, how? So you had the procedure. Things went well. How are you doing? Just share with us what's going on in your life right now.
Well, they had me in the nursing facility doing my rehab, and the pain is gone in my leg. Like, I'm able to, for the first time since like June, since I got discharged from the hospital, I've been able to move around without pain in my leg area, in my knee, the pain that I was having beforehand whenever I tried to walk. That's pretty much gone at this point. So now it's just waiting on the wound to heal up. I'm not allowed to put weight on my foot yet because of the wound, obviously. But once they closes up some more, then I think we'll be good to go.
Very
That's
good.
incredible. So you're doing physical therapy along with this?
Yes. Yes.
And so they're teaching you ways in which you can help to improve circulation and keep those collaterals going and keep your arteries strong?
No, not at this time because I'm not,
Oh, no, not yet.
I'm not weight bearing on my foot. They're just helping me strengthen my core and my arms and everything. They had me using a wheelchair to get around for a few weeks, so since I wasn't allowed to walk.
But I mean, man, you're an inspiration though, right? Like you've been through a lot in short from May to now. It's October, so about whatever 5 months. Just open heart surgery, new valve, limb that you almost got. I mean, dude, well done, brother.
Champ.
Yeah, your pig and the piggies were saved.
Yes.
That's a victory. That's a victory. Well done. Well done, everybody. Love it.
That's amazing. Dr. Salhanick, what do you think the durability of this is going to be? Is he the type of patient that is up for this revolving door, or do you think that this was more of an isolated thing and you think that he really has a chance if he exercises, makes sure to control the diabetes and takes his medication, that he should be good to go?
I think Benny's already shown the quality that he has as a patient that is going to be, able to do this long term. We're together now, so that means that any and every problem that Benny has along the way, he knows where to find us.
You guys are like, you guys are
Where we
married.
are.
You're married
Exactly.
now.
So I always tell patients that, and I tell you again, Benny, like everything and anything you need, you come, you know where we are. We're going to be here. We're going to be here for a long time. So we want to be there on that journey with you. There might be some bumps, but I think that like Dr. Phillips was pointing out, you're doing everything that you need to do. And, and to be frank, you're doing the hard work as much as, I want to sit there and say, oh, this, what I did was hard. I mean, like, it's challenging technically, but the fact of the matter is it's the day in, day out, making sure that you're doing the things that you need to do, from, managing diabetes, managing blood pressure. It's not exciting. It's not sexy necessarily, but that is what's vitally important because that's what keeps these arteries from getting damaged again.
Congratulations. Thank you so much for sharing the story.
Comprehensive and personalized education.
Peace out, everyone.
High touch and support for patients at
This is our after show to the Save My Piggies broadcast. We're with Marc Salhanick, Dr. Marc Salhanick, out of Dallas, Texas, and Benny, one of his patients who just had a limb salvage procedures in rehab, looking to heal this wound. Of course, Dr. John Phillips is here, the founder of the Save My Piggies Health and Wellness.
Kendra, before I forget, let's get Benny's address and we'll send him some socks, Save My Piggies socks. We're going to start doing that.
I would love to do that. Benny, we'll have to do that. So I'll hopefully connect with you and then you and I can, I'll get your address. We'll send you some socks if you don't mind if we have your address. We won't send you any ARP mail, as we talked about before.
Young.
Yeah, that's right, man. I'll forward all my AARP to you.
Oh, man. He's too young.
Forwarded to Benny. Poor Benny. You don't know what you're getting into.
I know, man. So Benny, I wanted to ask you this, like, honestly, prior to this stuff going on in May, I'm assuming you were a pretty healthy guy.
Yes.
So, I mean, how does that affect your psyche going through all this stuff and then ultimately getting the heart fixed up, thinking, man, I could lose my leg now too? Like, what the hell? How did you stay positive?
Have good support. I have close friends help me get through it. It was a little rough at first because I'm used to being able to go out and do whatever, work all the time, go to baseball games, go to football games, spend a lot of time going to games and being active. And it was rough at first being laid up and not being able to do anything that I'm used to doing. So it was pretty tough at first, but I just pushed through it and got through it.
Yeah, you are so young. I mean, that had to be devastating because people your age, for the most part, I mean, you walk everywhere. You're active. What were you doing prior to all of this? What did your life look like?
I spent a lot of time at work. I work in a warehouse, and it was, I don't know, just seemed like I was at work a lot. And if I wasn't at work and I was at a Rangers game or some kind of sporting event. That's what I do in my free time. So
What is that? The Horned Frogs? What team is that?
yeah, TCU college.
TCU. All right, sweet. Are they playing right now?
They play at 2:30. So
cool.
play Kansas State today.
Yeah, we got to be out.
We got to make sure you get on that. Well, 2:30.
Yeah. So what are you looking forward to most, Benny? I mean, as soon as you get out of rehab, what are you excited to do the most?
Probably go back to games. I have season tickets for TC football, and I had to miss the first couple of games that we played at home this year. So that'll be the first thing that I want to do is get out and go to a game.
All right,
That's
cool.
amazing. Yeah, thank you so much, Benny, for being here. Any last piece of advice, though, for other people that are going through this? We have our friend Robert that is sitting there, and he's back and forth between the hospital as well, and is dealing with below the knee issues. And he's a young guy too. I mean, he's 68, but that's still young. Anyone below 70, even 70s, I tell people that they're young because I have a couple 100-year-olds in our network. But I know, right? I mean,
I have an
it's
85-year-old that's going through what Robert went through. The difference is that the 85-year-old surgeon was not worried about doing what needed to be done with his bypasses to help the outflow.
It's so frustrating. And so, Benny, what advice would you have for other patients that, may, be in the hospital for heart issues? Is there anything that you would have asked your doctors or done differently, if you're looking back?
Well, to be honest, I wouldn't have went to the urgent care. When I first started having problems with my foot, I went to the urgent care instead of going to the emergency room, and they diagnosed me with gout. And obviously, I think I had a little bit more serious issue than gout. But yeah, don't be afraid to go to the doctor and ask questions. So I think if I would have just went to the emergency room at first when I first got sick, then we probably could have avoided some of this. But
yeah, what do you think, Dr. Salhanick? Do you agree? I didn't realize that he went to the urgent care.
Yeah, I agree. But the problem is, I mean, I think more to the point is the second part of what he said is that if you don't feel like you're getting the answers that you need, keep asking, keep looking. Be insistent on it. And that is something that I really respected when I first met Benny in the clinic, is that there was a feeling of like, hey, I'm getting the runaround on these things. Like, I know there's something wrong. There's clearly something. I was fine before then. Now I'm not fine. And the person that was with you as well was your advocate as well. And sometimes it's hard as the patient being an advocate. So having those friends and family around that is like, we're just not getting the full picture here. Keep pushing, keep asking. It's not being rude. It's not being, anything other than like you're a concerned patient. This is your life. You
But
have
the
a
problem
right.
is that it seems logical. I mean, at what point did you realize, Benny, that something just isn't right here? Because I would imagine you have a wound. They say your wound got infected. It's a pressure sore. It's because you were laying in the hospital. That all seems logical to me. Why would you think as a patient that there's something more?
I didn't at first, and I think that was part of the problem. I should have probably pushed a little harder when we discovered the pressure wounds. But like I said, I took their word for it on what they told me. Don't worry about it. That they were healing okay, and I probably should have pushed a little harder once we discovered them. That's the only thing I can think of that I would have did different.
At least you pushed. I mean, some people don't, and and they're in a totally different position than you are. So,
and especially those that have diabetes. I mean, there's so many patients that end up. What is the number that we got from Dr. Eric Sazemski saying more than 60% of all amputations are being performed without a doctor trying to restore lung flow, but even worse is 90% done without a vascular evaluation. And that happens with a lot of especially diabetic patients, that they end up with a wound and no one checks their circulation to see if that has been a factor in why their wounds aren't healing.
I mean, the numbers have gotten better. I know there's some recent data out of the VA that it's less than 50% are, their first kind of procedure is a amputation, but still, I mean, we've learned that the cost of the major amputation costs much more than any of the procedures that we do. I mean, and the other thing too is the fact that we can all agree as interventional cardiologists, vascular surgeons, IR. I mean, like if Marc and I can have this conversation about, hey, let's just do what's right for the patient, and we can, on the podium and on panels decide and get granular about it, but do what's right for the patient and get the patient to the physician that can help them, whether it's a surgeon, interventionalist, whatever. Just do what's right for the patient. Everybody wins out. It's easy, frankly.
Dr. Salhanick, I have a question for you. And maybe I should have a question, and you could probably also answer this. I was at an event a couple of years ago in Montana speaking. It was a COPD conference, and a lot of patients that have COPD do have PAD, and they wanted to know more information. I had several of the nurses that spoke up that work in the hospital that say, as part of their rounds, they're always checking the pulses in the feet, and they put in to the chart that whether there's diminished pulses or whatever, it's part of their rounds. And they told me that literally 100% of the time, no one ever follows up on it.
Ignored. Yeah.
And so is that something that you guys are finding as well?
All the time. I mean,
Really?
I think Benny's case is a great example.
Yeah.
I mean,
and it's not just nurses. I mean, I was talking to one of my partners, and we're cardiologists, right? And we both said, you know what? Everybody gets an echo. I mean, like, do we need a stethoscope anymore? I mean, yes, we have one, but what you need to do in an exam is assess for pulses. That's what you need to do for the patient. And if you don't have a stethoscope, that's fine, but at least feel for pulses. And that's what we tell our residents and fellows, like, you got to feel for pulses. You got to get used to it. Because to Marc's point, Benny, if the plumbing is intact from the heart to the toes, you should be able to feel pulses. And if you can't, there's something wrong.
Yeah.
Easy.
Yeah. And I think
if there's no wound, then I mean, I'm very, very conservative. But when there's a wound, I mean, it's game on. Like, we're going to throw the kitchen sink at this thing to get it healed, because if we don't, the alternative is amputation.
100%. 100%.
Yeah. And we appreciate all you're doing. Thank you so much, Dr. Salhanick. And Benny, we'd love to hear when your wound's healed and have you back to share with us what your life is like beyond all of this, because I see so much promise, so much hope ahead for you.
Oh, no problem.
And don't forget to give us your address if you're comfortable with it. We'll send you some socks, and also send us a photo when you get back to football. And what baseball do you? What college baseball or MLB?
Both Texas Rangers and TCU.
Rangers, that's right. It was a little hard this year, but you know what?
Rangers,
it's okay.
I love it. I want to get to, and Benny, I know you have some rehab and things to do. You're welcome to stick around.
Pull for the brew crew today. We need to beat the Cubs.
I do have Robert, who's on our thing, and I wanted to acknowledge him. He is messaging. He's through our YouTube. And Robert is 68 years old, 3 bypasses, 2 failed, 1 still working so far. Was walking and was getting cramps in the calf, started drinking Diet Pop today, October 11th. He's been smoke-free for 2 months since August 11th. So good job, Robert. That is exactly what it's going to take. And maybe that is one of the reasons why this new bypass is starting to be successful. So that's pretty awesome. But he's now missing 2 toes. He wants to know if that's really part of it. He had an infection in his big toe and his little toe. So they've now been removed. And I would imagine with those circulation issues, probably related.
So hard. The thing is, and this is the other reason why I didn't want to do surgery, is that, once you start down the surgery pathway, it's hard to get off the surgery pathway. And you start making people dependent on the surgery that you did. To some extent, endovascular surgery, if it all fails, it's just going to go back looking like the way it looked when I first showed that picture. And if that's what you had before the operation, then you are going to be fine. So if we can get the wound healed, even if the arteries close back up and you're not having symptoms, then that, in my mind, that's a win. And your body's figuring it out. And then if you get a new wound, then we'll do what we need to do. So the point is, when you start getting into multiple bypasses, now you're starting to talk about some severe inflammation that is now making your atherosclerotic inflammation even worse. So it can kind of have this compounding effect. And you're 3 bypasses in. This means that you've probably used your saphenous vein, which is a fantastic option. Do not, I don't want any one telling Dr. Farber that I'm not saying, single segment saphenous vein isn't great bypass conduit. It is. It works very well. We have a lot of patients that have that, and they're doing great. But the point is that there's just one of them. And then you use that up. Well, I mean, Benny is 47. Benny's going to be around for a long time. And we have to think about what's going to happen 30 years from now. If Benny gets a new wound or something like that, we need to have some options available for him. And so that's something I think also needs to go into the thought process behind every procedure that we do is what do you do 5, 10 years from now when that fails, or even worse, 6 months or a year from now when that fails? So the point is that I think what you're doing with lifestyle modification is the best thing for you. Every cigarette that you don't smoke is a toe that you get to keep. And let's see how you do from that. The other problem is that you do have a bypass, which means that we have to do maintenance on that bypass to keep it open. You should be seeing your doctor probably. I mean, at this point in time, I would say you're 3 bypasses in. I'd be seeing you at least once a quarter with an ultrasound to make sure that everything is going the way it's supposed to. And if I felt comfortable with it, then maybe every other, or maybe every 6 months. But the point is that you would not be far from my practice at any point in time because I'm really worried about those bypasses going down and your dependence on them.
And no one has tried literally going in pedal, meaning going in with wires and balloons through the foot. I was told, by the physician that there's no outflow. So this is the best chance that it's going to just reperfuse. And I said, well, why not take wires and balloons? And they said, well, I've gone further than most people would do in my area. So if I can't do it, no one can. But I said, you might, Robert, always have a couple options before
you need to be
every
in a different
doctor.
area.
You don't care, Dr. Salhanick, right? If someone just gets a second opinion, someone might just have a different set of eyes, different tool. For example, in your case, you have the spur. Maybe someone else doesn't have the spur.
And I mean, I ask all the time for second opinions. I mean, I wish that Dr. Phillips was still on, and we had talked about Dr. Dawes, who I work with here in Dallas pretty frequently. I ask him for second opinions all the time. He's an interventional cardiologist. He has great work. He's down in the pedal arch and taking care of everything that needs to be taken care of there. I have a lot of respect for him and what he does. And if I can't do it, I tell patients. I've told them a couple of times. I said, I can't get through this, but that doesn't mean it can't be done. I want to send you to this other guy who I think he has probably better skills in that department, and let's see what he can do. And he's done it. And, that's great. Because when you start talking about things that go from the mid calf down to the foot, we're talking about areas that really don't have open surgery options. I've done some bypasses onto the DP, the dorsalis pedis, the artery that's on top of the foot. That works if you've got single segment saphenous vein and you've got a really good looking DP. That's a lot of ifs. And the fact is that if you don't feel that you have the skills to do it, it really shouldn't be like, well, nobody else does either. We should find out. And if you don't know, you better ask somebody. And I do.
It's interesting. Do you find, we talked about this actually recently. And so for those that are watching right now and you haven't seen, Dr. Salhanick did a comprehensive interview with us just the other day. It was an incredible Q&A. If you go to our YouTube channel, youtube.com/the way to my heart and look under the live tab, you'll find that really, it's a comprehensive interview and he goes into detail on a lot of these things. But we talked about the 2 different types of PAD, the traditional PAD and this newer, the one that's in the textbooks, but this newer PAD that is purely like the bottoms up disease with diabetes and chronic kidney disease. And I have found with our patients that the bypasses where it used to be with the traditional disease, even if there was some below the knee, the bypasses seem to be strong. I have patients that have had PAD for literally 50 years. And I have this one gentleman and his FemPop is still intact, many, many years later and doing great. But this diabetes and chronic kidney disease driven PAD,
very different.
I'm having a lot of trouble with the durability of the bypasses distally.
And I come back to that's just a disease process. I tell patients this all the time. I'm not going to fix the thing that damaged your arteries. And so that's where we have to think about what we're doing and the longevity of it, because if we're being honest with ourselves, the disease process is different. And that's where I have problems with these big randomized trials. And it's not that they're designed poorly, they're designed very well. The problem is just that it's so individualized now, and it's just so rapidly evolving and changing. And in different parts of the country, it's still very different. Because like what we see down here in Dallas, very different from what is seen up in the Northeast, in the Midwest. And um, it's not the bypass's fault necessarily. It's not the person doing the bypass. It's just that it's a hard disease process. And you do have to bring as many tools to bear on it as possible. You know, you were talking, Kim, about the fact that there is an bypass, and you know that, oh, they didn't want to go below that. I mean, I have a patient that I just did a bypass on about 4 months ago, and very clearly there was a lot of problems with that outflow vessel. And I just said, you know, we need to go back in there and do it. And we went and were very aggressive on that single vessel outflow for the bypass. And as a result, we've dramatically improved his flow. And actually, I can kind of wish that I had been more aggressive with it earlier and done that sooner. But the point is that it can be done. You have to be careful with it. But it should be done also, because, you know, if you're not getting the blood flow to heal things, it doesn't really matter what your bypass is open or not, because it's not doing its job.
You know, and there's also the balance. I had a conversation with Dr. James Santazana, also a vascular surgeon out of North Carolina, because we had a patient that he doesn't have any wounds on his foot. He does have one solid vessel going down below his knee to his foot. It was able, with what they did, extensive work, they you know, right, with the phone, they call it the woundogram. What do they call it? The woundosome now, where you know, right, which vessels are feeding which. And so you really don't want to go in. And people always ask me, well, why didn't they go in and open up all three arteries if they could? And it's like, you got to be very careful down there. They're very fragile vessels. And with this different disease process, no one really understands it extensively. There's still so much we're learning. But what we do know is if you go in there and you do too much too soon, that is only going to lead and accelerate the process to amputation. So you still have to go in strategically.
Exactly. And what I've found is that sometimes, you know, you go in and we're working on one artery and we try and go to another artery, and that damages what you did on the first artery. So, you know, you got to be careful about that. And again, have a targeted approach. That's why with Benny, we went in and we targeted that posterior tibial artery, the artery that goes behind the ankle that generally feeds that part of the foot. And we were able to reopen that. And he's got, you can see on the angiogram, he's got really significant blush in that wound, which signifies the fact that we've revascularized the artery that brings blood down to the wound.
And I think that's so important. This patient, even though they didn't have a wound, the wound was healed. They actually came into our group, and, you know, the family member was like, hey, we need a different doctor who can open up these arteries in the foot and this and that. And I thought, it's really weird. She's in with one of the most advanced vascular surgeons. And I like vascular surgeons, you know, where you push it to a certain point, but you're not overdoing it. So and I think that's important. So I made sure that the two of them got on the phone so that the family could understand that, hey, we're going to keep an eye on this.
Right.
But, you know, sometimes less is more. If you don't have a wound, protect your feet. Right. Do the foot exercises every single week. We have a session on Wednesdays. It's at 8 a.m. Pacific time, 11 a.m. Eastern time, 10 a.m. Central, where we have different doctors of physiotherapy, experts in athletic training, things like that are on there to answer questions about even exercises you can do while you're sitting down, which is why, you know, I was saying to Benny that, you know, hey, in rehab, are they doing anything to offer you some exercises that can improve your circulation while you're sitting down? If it's toe yoga, we call it, or the pushing the accelerator button forward, or whatever it might be. But those have been clinically proven to improve circulation. Now, there's no level 1A evidence for PAD specifically, but the evidence is there that some of these exercises are intended to improve circulation and do improve circulation.
I agree.
So it's really important. So Robert has another question here that just came in from YouTube. Why would I have all this, fluid in there? I'm not sure if he's talking about just fluid from maybe his legs are swollen. It may seem, Robert, you might want to clarify, but his legs might be swollen, and that may also be adding to the problem, because a lot of times what we find, and this is why I like, vascular surgeons, is you have a lot of experience with both the arteries and the veins, and you're more apt to checking the veins to make sure that the blood has a place to go.
And the other problem is that there's the lymphatic system as well, the drainage system, and it's very delicate, it's very fragile. And you start putting incisions on people, you're cutting through those lymphatics. It's disrupting the way that fluid is draining out of your legs every single time. And so, I think that trying to get aggressive with that, we've actually found that treatment has been just as effective as fixing arteries. So I think there's a lot of questions that I would have to answer. And again, as we had talked about, we don't really have the full clinical picture with these kind of talks. But suffice it to say that it's a complex problem. I mean, that's why I haven't gotten a chance to say it, but my business, complex vein and vascular specialist. But that's why we named it that way, because, it's, I think it's a disservice to patients to say, oh, well, we'll just go and it's just a little thing. And it's very rarely, if ever, a little thing. And to be frank, the little things seem to be the ones that actually end up being a much bigger deal. So, yeah, a lot to investigate.
Thank you so much, Dr. Salhanick, for being here. We really appreciate you. We hope to have you back again. And crossing my fingers, maybe we can work on that additional radio show that we want to do over in your area, which would expand clear up to Oklahoma City and out to College Station. So it would be really fun to get a group together, and I might just reignite that this week and see who's interested and be able to help put together a program for your entire area that we can syndicate across the globe to continue to spread awareness for PAD and educate people about vascular issues.